If you have a patient-centered medical home, you really need to pursue the patient-centered specialty practice. We felt that we really need something to complement our patient-centered medical home. They complement each other, number one. Number two, they work together for smooth care delivery.
The concept of closing the loop between the primary care physicians and the specialists within the medical home and the specialty practice probably can't be overemphasized. I found it really intriguing that when we decided to do this and we approached our primary care colleagues, their eyes just lit up. I mean, it was actually amazing. They were so thrilled to hear that, we were going to, start this. It sort of just made me understand, how important it is that the patient is at the center of this, but that every provider, everyone who's touching that patient needs to be on the same page, and that this was really a mechanism in which to sort of close the loop so that all of the communication and all the care was much more seamless and transparent.
For me, it was a huge job satisfaction. When I feel that when I place a referral, I'm sure that it will happen. I will be able to track it. Don't only look at it as a way to improve patient care, but also the way to improve job satisfaction for the nurses and the physicians and the schedulers and everyone who works in your practice.
I think a lot of it is the mindset and the culture change that when you adopt this type of model and putting the patient really at the center of the entire decision-making process by putting these standards in place and enabling expectations to be set and quality metrics, to be put in place, it really just sort of steps everything up.
We've gotten a great amount of feedback and engagement from the payers, which has allowed us to both enhance patient quality and our reimbursements.
We see that a lot of HMOs especially are interested in looking at the patient-centered specialty practice model. And if we remember when patient-centered medical home started, it took some time before the payment was reformed to recognize that.
For the smaller groups out there that are listening, I want to encourage them that these goals are obtainable. You'll be a stronger group with the quality of care, greater patient loyalty, and also greater reimbursement.
One advantage of going through the patient-centered specialty practice is that help you to look at your process and improve things. That was very useful for both the referring physician and the consulting physician.
This is not one size fits all. All practices can do this. Each of us in the different settings that we practice in may come with different challenges in terms of how to get through this, but there is certainly, with time, with perseverance, and with addressing, the different processes, all of these standards are surmountable.
We really made a lot of effort through our work to live the standards and be focused on implementing them. We engaged everyone, providers, nurses, front desk, schedulers. In fact, it was really interesting to see all those people sit around the table discussing one of the standards. I will say for the practices that are looking into starting the journey, NCQA provide a lot of training. We found that this helped us a lot to focus, number one. Number two, to see what examples are there and how we can raise the bar.